would be the perspective on this discussion on the part of an MD or DO, do you project?
Well, we have to realize that, you know, when we talk about conventional and thyroid, they think the gold standard is a TSH test, which stands for thyroid stimulating hormone. And we have to realize that that's only one little step of it. We have to realize that free T3 is the active hormone that works at the cellular level. Very important that we test for that in the blood. A lot of times the blood tests that they run may have bound T4s or the T3 uptake, which is kind of an indirect measurement of what's actually the free T3 quantity actually in the blood. And so what we do is we actually look at the whole aspect of it. We look at the adrenal glands, and we have to realize that, you know, a lot of times the HMO and PPOs, they don't want to run all those tests. They want to run a TSH. If that's abnormal, then they may say, well, let's run the additional test. But to really look at the whole thyroid gland, you really need to run different tests.
How is the test that a physician might run any different from what you're doing? And I think we have a slide to look at, 4E, on functional testing.
Well, as I said, from functional testing, we're going to look at the thyroid stimulating hormone. We're going to look at the free T3. We're going to look at the free T4. And remember, I said earlier that the free T3 has to be converted into T4. And so we need to see if that step's occurring. To just do a TSH test is not going to tell us what T3 is doing in the body. And the free T3 is what does the work at the cellular level. And then we're going to also run a thyroid perioxidase antibody test to see if there's an autoimmune disorder of the actual thyroid gland itself.
Right. Now, what we're really talking about right now is your approach to thyroid problems from the perspective that there's some things you can do with detoxification, vitamin usage, this type of thing, change in diet, to improve your general health and make a condition in the thyroid a little bit better. But these are all part of the province of alternative medicine to make somebody a little healthier before they have a disease, let's say, that would put them in the hospital. So is this really all about maximizing your health? And when we take a look at these T things and the tests, it's kind of some quantification that you do to see if people are on the right road with that particular system, the thyroid?
Yes, and you have to realize that, you know, it's not only to see if they're trending or to prevent it. If people have hypothyroidism itself, it's something that by using the proper nutrients and healthy lifestyle changes and dietary changes, you can actually reverse that process. So we don't only look to see that, make sure that we're trending properly to see if we're correcting the problem, but if they already have a problem, we can use these nutrients to actually make them well.
Doctor, let's go back to the beginning again. What are some of the common symptoms that Americans have that would indicate they may have an issue with their thyroid?
Well, one of the biggest ones is probably cold hands and feet, where they're in a room where everybody else is comfortable and they're freezing. That's probably one of the biggest ones that drive me in. The other one is hair thinning, loss of the outer third of your eyebrows. The outer third actually just falls out. You know, sluggish metabolism, no energy. That's probably the second biggest ones that bring them in, or maybe the primary one that brings them in is they don't have any energy. And we have to realize that the thyroid gland is the ones that controls the metabolism and the energy of our body. In fact, the thyroid and adrenal glands produce 98% of our energy in our body. So usually fatigue is the one that brings them in.
And of course, fatigue is related to stress, and stress is related to a crazy lifestyle and a bad diet.
Well, there's a lot of stressors out there. You have emotional stressors, you have diet stressors, you have environmental toxins, you have pain and inflammation in the body, blood sugars that can also cause stressors to the adrenal gland. So yeah, there's a lot of stress out there.
Now, there are some other tests that you utilize other than the TSH that a functional medicine physician is how you kind of view yourself, I think, that you utilize. Explain those other tests.
Well, first of all, what we need to do is talk a little bit about, you know, what functional medicine actually is. And basically with functional medicine is that we look at the whole body. We look at the whole endocrine system, not only the thyroid. We're going to address the adrenals. We're going to look at the female hormones because estrogen dominance can play a factor with the thyroid gland. And we have to realize that in functional medicine, we have what we call functional ranges, where that they're much narrower than the pathological ranges found on a blood test. And so what we do is not only do we look at the thyroid, the TSH, the free T3, the free T4, the TPO, but we may address the adrenal glands. We may look at the adrenal glands. We may look at their gut because, you know, some of the thyroid hormones are converted in the gut, and if the gut's not healthy, they can't convert back. So we're not only going to just look at the thyroid, we're going to look at the whole system, what could be causing their symptoms.
Now, this is an area you have extensive personal knowledge on, and you're writing a book on the topic. Let's talk a little bit about your book.
Well, my book is called Thyroid. Your Thyroid Chemistry Doesn't Lie. And basically, if you want to pre-order it, you can go to my website and pre-order the book. It's going to be published here very shortly. And what I'm trying to get across in the point of the book is that, you know, there's so many people out there that go to their doctors and they may be in that normal reference range and they're still having all the symptoms of a thyroid problem. And maybe the medical doctor says, well, we tested your blood, you're in the normal reference range for the blood, so your thyroid's working quite fine, and they have all these symptoms. So the message I'm trying to get across in my book is that we have to check other things that are related to the thyroid, like the adrenal glands, like the female hormones, like gut issues, all these different things, stressors. The adrenal stress index test is probably one of the biggest ones I would check, because that can really have a big effect on the free T3 in the actual body. So the book is there. It's kind of written for layman's terms, but it's good to take to a medical doctor who's not familiar with functional medicine, and it can shed some light on the topic that there's a lot of people out there suffering from what we call subclinical hypothyroidism, and they really haven't been addressed, and they have all these problems.
Okay, let's talk a little bit about lab reference ranges, and for people who think they have a thyroid issue, you're going to be definitely familiar with this one.
Yes, and let's first of all, we have two types of, we have what we call the pathological lab ranges, and normally most labs and every lab ranges are a little bit different, but we have to realize that we get these lab ranges from a geographical area, let's say like Northeast Ohio, and we run these tests for a year, and then we put a bell-shaped curve up, we throw some of the high ones out, and then they end up with what we call the normal reference range. And so for the TSH, 0.5 to 5.0 is where what was actually was. So in functional medicine, as I said earlier, we tried to narrow it down. So in functional medicine, we're looking at 0.3 to 3.0. And we have to realize that these are things that I didn't pull out of the air. The American Endocrinology Society has backed this concept up, that we can try to prevent people from getting into the pathological state, or some people may be in that normal reference range and still have full-blown hypothyroidism.
When people come to your practice and they learn a little bit about thyroid, what are the things that they're surprised about, that they didn't know? You probably have a good feel for this.
Well, the thing I think they're most surprised about is that they probably didn't know how their body functioned at a cellular level. So teaching them the basics of the chemistry and the physiology of the body, and says, if you don't have, if your stress is too high and your cortisol levels are too high, you can't convert this hormone into this hormone, therefore that's going to make you fatigued. So if they understand the concept of why and how their body is, what's going on with the body, then they're going to understand how they can actually correct that. So in functional medicine, we try to get to the cause of the problem. We try to change the chemistry and the physiology. We monitor their thyroid testing, through testing, to determine if they're actually getting better. So I think the big thing they gain from it is they get educated about how the gland actually works, and it really makes sense to them, because it's basically common physiology.
Now, if you were to go to an MD or a DO, what's their approach to treatment of a thyroid?
Well, of course, they're going to do drug replacement therapy, and a lot of times that works. You have to realize that Synthroid is the #4 medication and been for many, many, many years, as far as the amount that they actually sell and the amount of money they make on it. But we have to realize that Synthroid, or levothyroxine, is a T4 medication. And as I stated earlier, T4 has to be converted into T3. And the free T3 is what does the work at the cellular level. So if somebody has to convert that synthetic T4 into T3, and they don't have enough selenium, they don't have enough zinc, they have high cortisol levels, that can all inhibit that conversion. So they put them on the T4 medication. They go back to the doctor, say, doctor, I'm still not feeling good. I still have all the symptoms. Well, your TSH looks better now. It's working, you know, give it some time. But they still have all the symptoms. So it may be a conversion process. And if they're not testing for that, they could actually miss that in critical step. And so, you know, medications do work on probably 25 to 30% of the people. But there's other people who are on it and say, I don't feel any different. Is there any more answers I can get? And that's when they come to me.